There's benefits to local anesthesia. Number one, it's less drastic, and theoretically it's less of a complications that come along with it. There's less risk of blood clots theoretically, and other problems that can occur with general anesthesia. Also, some people say recovery is faster. For one reason or another, there's less bruising and you're back on your feet just faster. You save a few $1,000s just because you don't have to pay for an anesthesiologist. So you pay for the surgeon fee, the room fee, but there's no anesthesia, there's no anesthesiologist, and so those savings are passed on to you. Some people are afraid to go to sleep. Maybe something happened to their loved one, or they're just afraid of being under general anesthesia. And if your procedure is not too large and too involved, then you can have your operation under local anesthesia. Somebody, your friend or somebody went for local anesthesia and they say they felt everything, meaning they felt pain. There's a few reasons for that. Number one, maybe the surgeon wasn't experienced enough to perform local anesthesia, and so there's a little bit of a learning curve with that. Number two is maybe the patient was not prepared. You have to be prepared and know what to expect, because you will feel something under local anesthesia, but what you will feel depends on how ready you are. Because if you're not ready, you don't expect it, you'll feel pain. If you are ready and you know what to expect, discomfort, then you'll feel pressure, vibration, you'll feel a little bit of a burning, various sensations, but not too much pain. In fact, most people say it's better than they expected. And I do local anesthesia a lot, especially for liposuction. And so in my experience of over 5,000 or so cases of awake surgery, most people say, I was worried for nothing. I couldn't sleep, but I feel better. If you do choose local anesthesia, the way to maximize your result is just to follow instructions, know the process kind of the surgery, talk to your surgeon wherever you go, stay relaxed, follow instructions, let the surgeon do his operation. If you're dramatic, if you are responding too significantly to every little movement, then you probably need to go under general anesthesia, because then just local anesthesia is not for you. Now that said, most people choose local anesthesia, at least in my practice, for some procedures, and they do really well.